Good day. It's Thursday, April the 15th. I'm Martin Gago with Radius Research. Today we're joined by Andrew Morton, CEO of Maitri Health. That's MTEC on the CSE. Andrew has a very interesting resume with over 20 years in senior roles in Silicon Valley. So this should be interesting. Andrew, thank you very much today. And why don't you tell us a bit about the company first, and then we'll follow up with some Q&A and some discussion on how things are working.
Certainly happy. Great to be here. Thanks. So give a quick background on myself as we get started here. I have worked the last 20 years just south of the border. I'm a Canadian, and I like to jokingly say this is the first time I've had a Canadian business card in a couple of decades, but actually started my career here in Vancouver. Gosh, way back, I have to date myself, in the mid-90s. I actually did stints at Lexmark, an IBM company, and then way back then was at 3Com. 2001, I moved down to the US, primarily because there were some big opportunities there, and actually co-founded a business in Orange County and had a successful run, actually building from zero to hero, we'll call it, in the tech industry, primarily in broadband internet, shipping to large broadband providers around the world. In the last decade, we'll call it 2010 to, just a couple of years ago, I was involved with a company called Entone. We actually had a successful exit from our venture-backed company in Cupertino, California, that we were actually backed by some of the largest VCs in the Valley, and sold to actually one of our competitors. Stayed on for a few extra years there as an executive. Most recently in 2020, of course, we had some very obvious events. I think all of us are probably watching this knowing very well what's happened in 2020, and even here, unfortunately, to 2021, where unfortunately the pandemic has affected everybody. Maitri Health Technologies was founded by a group of us. We have some very serious investors here, and when I helped co-found and build the business around really modernizing healthcare systems for post-pandemic. We recognized that some serious inadequacies were certainly identified by this pandemic. And what we recognized as a team is that there was some real needs, not just in PPE and materials, but overall healthcare systems. Those of us now are starting to see what we see are these binge diets called lockdowns. In the way, when I like to say binge diets are called lockdowns, it's that, unfortunately, every time we have a lockdown, the lockdown ends and things get a little worse. In fact, I just saw now Ontario's numbers for today are 4,700 cases, which is a new all-time record, which tells me there has to be a better way. And I'll give you some quick background on the organization and talk a little bit about what this business is about. And I did say modernizing healthcare systems for post-pandemic. Really the timing is here for a business to come along and help businesses function. The biggest thing we're hearing right now from corporations, from restaurants, from sporting venues, everybody, is that, really there's a real need to function and get back to work and stay there long term. And the realities of this are that, organizations, of all kinds are trying to figure out how do they cut a path forward. We have a very strong team, and I'll get into some of that, but just to kind of give you some quick highlights, our board is made up of people in former government, former executives from big pharma, and myself, of course, the technology industry. And we also now have a very strong CTO and CFO on our team. And really, this is all about building the right products and the right services. And there's really kind of two long-term needs that were identified as a result of this pandemic, which is that businesses, number one, will need to take on active role in the health and welfare of their employees. We're hearing a lot of stories right now about class action lawsuits in the United States. And this is, there's been some things published around some of this, where meatpacking plants have had a number of deaths as a result of transmission on site. And now, unfortunately, the insurance industry is taking a serious notice in this because they're trying to figure out now, how do they underwrite, large packages as a result of all of this? And really, there's a real need now for health tech software to do that, and that's what we're here to fix. The other side of it that was interesting that was identified was that in the industry around PPE in the last 12 months, some really unusual things happened. Way back in, we'll call it March, in the dark days of March and April, there were some well-documented scenarios where PPE was shipped to large public healthcare facilities, hospitals, schools, that kind of thing, that was discovered to be unsafe and in many cases fraudulent. The unfortunate situation is that, way back, the last 2 decades, what we discovered was that we kind of built this imaginary wall between ourselves and the supply chain offshore. And what that really created was this buyer's market for PPE. Enter kind of the dark days of 2020. What that actually created was, unfortunately, a seller's market, which flipped the entire thing upside down and unfortunately brought in all kinds of dark money. broker types that were just flipping PPE and not really having any understanding of what they're selling. And unfortunately, in many cases, some questionable practices among the actual manufacturers and sellers of that PPE. There's been a real push now by governments to buy local to fix this problem. And we've addressed some of that by creating a network of domestically manufactured, sourceable, traceable PPE. So masks and shields and that kind of thing. But while we're at it, why not make it intelligent? We created what I like to call a category called smart PPE, and I'll get into that as well. One of our advisors is Dr. James Shepard. He's at Yale Medical Center. And Dr. Shepard, he did say very publicly that, with the vaccine, the current pandemic will last an additional 3 years or more. That's with a vaccine. And the great news is we have vaccines, and that's fantastic. The unfortunate reality is these spikes keep happening as we have these shutdowns and openings. And the unfortunate thing that which generally tends to really bring down the room is that the pandemic is expected to last, beyond, we'll call it 3 years, but we may see another one within the decade. If at the very least, nothing, this pandemic will definitely evolve to an endemic, and that it becomes a condition that is regularly found among particular people or in a certain area by definition, which basically means it's always there. And no different than other situations like the flu and that kind of thing, regular boosters and regular management of the situation is always going to be a concern. And organizations are going to have to manage health and welfare of their employees. And there is that need for a system to manage this well into the future for that. If you look at the market by itself, the demand for PPE is expected to exceed somewhere around 112 billion by 2028. I've heard larger numbers. I've heard 128 billion, 123 billion. In general, it's a huge number. This is the most recent number from Grandview Research as of this week. And what's driving some of this is that not only are public health care, hospital systems, that kind of thing, in dire need of good materials long-term, recognizing that protocols don't change. But the other big thing is that buy local is also a big driver for this, which means governments, hospitals, businesses are willing to pay a premium for what they would call, reliable PPE. President Joe Biden on the 25th signed executive orders for buy local. Our government here in Canada has also done very similar things where they're driving initiatives very publicly. If anybody looks at the websites that they offer for their purchasing, local gets the preference. And the reasons why is they can't afford for this to continue to happen. Very famously, the Canadian government had to throw away tens of millions of dollars worth of masks earlier in the pandemic. And we're hearing more news reports that there's probably a lot more to go that are unfortunately the federal stockpiles. So there's a real need for reliable local PPE and manufactured materials. But another big part of this that's really outside of just shipping materials themselves is workplace safety. And this is all about the software I mentioned earlier, where there's this way to create a work-safe environment. As we were selling masks and things to some of the clients we're working with, they all told us the same thing in the private sector. They need to find some way to manage overall safety, not just by materials, which is great, but some bigger picture, some bigger way to do this. And this is all about really a workplace safety program. So we created essentially workplace safety software, which I'll get into in a minute, which addresses what could be close to a $20 billion number in US dollars by 2025. And that's all about getting the economy running safe. And the pandemic, no doubt, is a 9/11 style event. In that, as being a 9/11 style event, things never change long term. Never stop. It's changed for the long term, I should say. Way back to date myself, I was certainly a freaking flyer back in 2001. Obviously, after 9/11 happened in 2001, the way I went to the airport absolutely changed. Security protocols, screening, what I could carry on a plane, all of it. Similar things are going to happen at the workplace for places to function long term. And unfortunately, the threat of lawsuits or challenges from unions and most likely government regulations is going to require a total change in behavior. So this number of $20 billion US is really all about long-term changed patterns. And our solution definitely addresses that, which is what I like to call kind of the 3 pillars of our platform. On the lower right-hand side, there is the software platform, which is workplace management and compliance, which really is the core platform for workplace safety. Outside of the traditional methods of HR management and that kind of thing, there's going to be a new job function in most big companies, which is a CMO or Chief Medical Officer. And what we're hearing now from large corporations is that a CMO or Chief Medical Officer is going to be a long-term position there because now they have to think about their own workplace safety. An airline has always had, as a great example, safety and compliance officers, because clearly, aviation is quite dangerous and safety is a big deal. But now beverage companies, meatpacking plants, law offices, unfortunately, really any place where people have to congregate and work together, you now have to start managing large populations of people. And part of that now, if you look at the square above that in the magenta, it's testing and vaccination management is going to play right into that. We're not interested at Maitri as a company that's going to offer, health passports and that kind of thing, because I think that, there's plenty of politically charged reasons why maybe that's not something we want to get serious about. We're a little more focused on organizations that need to turn a profit, need to get back to work. So rather than trying to get into health passports, if we can take existing data for vaccination management and work and test results and that kind of thing, we can now place it inside our platform. So now an organization can trace and track the safety of all of their employees. And that also feeds quite well into that third pillar, which is healthcare supplies. Smart PPE is materials where the source, it's certified, it's safe. And an organization now knows that whatever they purchased and their employees are putting on their faces or using as a sanitizer in cleaning areas or any of that is absolutely safe. It all starts with a journey from the workplace. An employee in the morning wakes up, they may fill in a little routine health screening survey. What they don't know is that, they're actually also not even receiving that unless it's already been confirmed that they have had their vaccination or their test results are positive, and meaning they're clean. So a negative test result is positive, of course. And then the idea is they're verified, but that verified also tells them, the employee, that others are also doing the same thing. So they know the workplace is safe. And the whole concept behind this is not to have it as an app and make it intrusive, but just have it as a simple web portal and an invitation. What's really happening as they check in via the security system, as they check in via however they normally get into the building, those kinds of activities are logged without them really having to think too much about it. Because, the whole idea here is not to create a boarding pass for the workplace, but to have a simple way to be able to track and trace people. And that's just simple links to things like security systems. What's really happening on the far right side is you see a dashboard, and that dashboard has the reporting tools and the information gathering. So an organization knows who's safe, who isn't safe, who should, and obviously what zones might be high risk. And as you get enough activity, something called artificial intelligence or AI starts to kick in, which happens probably after, several months to a year of actual real patterns, because that's really how AI works. And the whole idea behind this now in the near term is they have the reporting tools as an employer to show unions and governments and insurance companies that things are safe. One really good example that we have is there's one movie studio client we're dealing with. They do some of our masks today. They're also buying some other materials from us. And the head of the studio told us straight out that his big concern is every morning he wakes up, he doesn't know what the end of that day is going to look like. If there is a shutdown somewhere in the world of all of their productions, TV shows and movies, that cost to that organization is anywhere between $200,000 to $2 million a day. And he needs some kind of tool as a centralized dashboard to be able to show him exactly what's happening with all of his movie sets around the world. And this really inspired a lot of our thought pattern around this. And as we started talking to oil and gas customers, started talking to factories, they all had very similar needs. All of them have different individuals they have to report into, insurance kind of being the top of that list because there's a real cost to that. Because the liabilities of something happening 5-10 years from now are going to be probably even more severe given government regulations and probably a track record of more of these kinds of incidents, especially considering the caseload we have today. And this really all goes back to an organization as a risk management tool. The ability now to integrate things like vaccination records from third-party apps or test records from either internal or external sources will provide an organization the ability for a total picture as to what health and safety looks like. Now, I mentioned earlier a little bit about innovative PPE. And I was pretty serious about, lots of things when we got into this business. One of the things we really took a hard look at was the ability to reinvent some of this, and rather than just having a typical mask, like such as a surgical mask, because we were getting into things like, what I like to call onshoring manufacturing of PPE, we actually had the opportunity to get a better mask. And the mask we now just distribute here in Canada and the United States and now in Latin America as well is what we like to call a 3D mask, which is a surgical mask, but it just fits and feels better on the face. And, if you think about it, the surgical mask hasn't changed designs in like 100 years. So there's definitely a refresh that was needed. So, if nothing, the last 12 months has also provided an opportunity to improve the materials that are out there and available. We did just announce an N95 mask that's Health Canada approved. which is pretty exciting. And the key to this is that an organization knows where it came from, and it's actually made here in Canada. And I get to say FOB Vancouver, BC. We also had partnered with a Berkshire Hathaway company that actually makes a disinfectant that's non-toxic, biodegradable. And we also now have hand sanitizers that actually feel pretty good on the hands. And our shields were actually invented by a dentist and an individual who runs extended healthcare facilities out in Winnipeg. And there are people like Manitoba Health who are very happy with that shield. Reasons why: fits better on the head and covers the top of the head. So why not do that? But what makes this more exciting to us is the ability now to track and trace this all the way to source. So our masks, for example, have a QR code in the package. The user of those can just scan it simply, and they can see that it was, if it's certified, where it was made, when it was made. So if there is a defect or any kind of concern about it, that's secured all the way to source. In the healthcare world, this didn't exist before we came along. We recognized just how unsophisticated all this is. And what was amazing to us when we got into this business is these are the kinds of principles that have been in the manufacturing world of electronics for like 3 decades. So it was high time that the healthcare system was modernized in this regard. But it fits really to us really within a bigger picture. Because back to that employee pass and employer platform, intelligence and software for the workplace are the keys here. So really the employee has that health check, their vaccination is confirmed, their testing is confirmed, it's confirmed they're wearing PPE when they show up on site, and very discreetly they're tracked and traced within the workplace environment only. So we're not following people by GPS, we're not intruding on people's privacy, we're just keeping the workplace safe. And that employer gets something very similar: the ability to know that there's company safe data, they get to pull full analytics on what's happening around the organization, and at some point make some kind of predictions around where the safe zones are and the negative zones are. And the bigger thing this all comes back to is risk management. So now we can return to work, and we can the employer can also provide that proof of safety for insurance companies and unions and alike. The organization is made up of folks that come from this industry. I mentioned myself already. I come from the tech industry myself, primarily south of the border, though I am a Canadian, and quite happy to be carrying a Canadian business card and listed here on the CSE. Our CFO has deep experience in capital markets, and we recently announced our CTO, who actually comes to us after a 2-decade career, actually himself also in California. He actually was CTO and co-founder of DeviantArt, which is a very well-known platform within kind of the social media world. During their peak, they accounted for more or less 5.5% to 1% of all internet traffic, which is a significant number. It may not sound like a lot, but that's an incredible amount of traffic. Something like 2 billion page views per month is what they managed. What that gives us is an individual that understands how to structure complex data platforms. So as we build out our technical platform and continue to expand, especially in Fortune 100 style of customers, we'll have no problem scaling our technical platform and really being able to deliver intelligence around workplace safety. Our board is made up of former Minister of Health, Tony Clement. We also have as our chair, former pharma executive who was actually the CIO from GlaxoSmithKline, currently president of the CPDN, the Canadian Pharmaceutical Distribution Network, which is among the largest distributors of pharma here in Canada. We also are proud to have Jessica Federer on our board, former Chief Digital Officer from Bayer, and heavily involved in public health, does work with the UN, and certainly a great advisor to us. We also have Dr. Sam Pillersdorf, who is a retired physician, was in the Faculty of Medicine at McMaster, and heavily involved nowadays as a very active investor in lifestyle capital, capital markets, and health tech. On our advisory, I mentioned Dr. James Shepard from Yale Medical Center, but we also happen to have Dr. Ann Snowden, who is a global healthcare supply chain expert. We would have loved to have Dr. Snowden on our board, but obviously for conflict of interest reasons, we couldn't do that because she's also involved in a national study here in Canada on healthcare supply chain security. Certainly somebody that we look to for advice as we move along in our journey. We've also, of note, just recently added Bridget Ross, who is a former J&J executive and was also one of the presidents at Henry Schein in the medical division. So somebody who definitely, again, career pharma and understands large distribution. We also have Jody Butts, who was on the board of Canada Goose and also on the board of Bayshore, which is extended care in the Eastern Canada. So some quick highlights on the business. We way back, it's only been a few months, but we completed our RTO. in November. We are a public company on the CSE, trading under MTEC, as mentioned. Early customer shipments have already started this quarter, which is great with our domestically produced materials. We did just achieve our N95 Health Canada, but really the exciting part of all of this is that there's a software platform to wrap around everything that we do. And then we're already working now with some beta candidates for this quarter for some customers, and we expect some pretty exciting things with our launch with our healthcare platform. And the key revenue streams for the business, it's about health tech software for business, which is a SaaS model. And then, of course, smart PPE, and you wrap intelligence around things like masks and shields and that kind of thing. It makes it a lot more interesting for the right kinds of customers. And our go-to-market's very simple, expanding in our current sales channels, engaging transactions with large healthcare now as we speak in multiple countries, here, US and Mexico. We're now engaged with telecoms, property management firms, hospitality, and large transportation clients as well. And we're establishing massive distribution channels. On the software side, this is a SaaS model. And as a SaaS model, there is a very interesting model around a per employee or per seat type model for something like that. And what all indications are from the customer we're talking to, there's a tremendous appetite for something like this with what's a very obvious need. And for the first time in my career, I've never seen an industry where there was so much need and it was so obvious. Coming from the enterprise software world myself, you typically would always go back to customers and try to identify needs for them. There's no need to do that in this case. The most important things about this are, to really kind of wrap this up, we are a strong team of experts. We certainly have the right folks from various parts of the healthcare and business and technology world. Our cloud platform for return to work is very real, and we're very excited about this. We are shipping reliable PPE and healthcare supplies, but the bigger thing is it's a long-term system for reliable healthcare supply chain. It's not just that we're just selling materials, but it's a system. And really the whole point to all of this is integrating it to meet the long-term need. 5-10 years from now, the concept that all businesses are sharing with us is that they expect they're going to have healthcare protocols that they're going to have to continue with, so they themselves never are at risk again of shutting down.
Thank you very much for taking the time to chat. That's really good. All the best, and let's get you back sometime in the future and get an update on how things are progressing.
My pleasure. Thank you for having me.
All right. Thanks a lot.